My name is Teresa Nader, and I was diagnosed in January 2005 at the age of 48. And I didn't have any of the published risk factors for ovarian cancer. I had few medical problems at that time. I did have varicose veins, and I've had them for years from my first pregnancy onward. I had a history of irritable bowel syndrome as well, and a hysterectomy with the uterus removed, my ovaries intact. And I, too, kept my yearly appointments with my gynecologist. Before I talk about my earliest symptoms, I'd like to tell you, in case you didn't know, that in June 2007, three of the major organizations or groups came to a consensus of the four most common symptoms of ovarian cancer, and this includes pelvic or abdominal pain, GI discomfort, frequency or urgency of urination, and the feeling of fullness when you eat. And I had symptoms at least 7 months prior to my diagnosis, but they were unusual ones. I had an unproductive cough that lasted, and I had phlebitis, and very, very tired, and then I had a gradual weight loss. My story began in April of 2005 when I went for my yearly gynecological examination, and I complained of intermittent pain in the right side and feeling very tired. I was parking in D deck, and I would park at the lowest level and climb up to the 7th. And I noticed I just couldn't do that anymore. It wasn't that I was out of breath. It was just like my body just felt like it couldn't do it. And so the pelvic exam, she says, "Oh, your ovaries feel fine, and you're just getting older." And that was her last week of being with that practice, and she was moving out of the city. She did run thyroid tests, they were normal, and there was just no follow-up on it. In July of 2004, I started with the cough, and it was one that was dry. I also started with phlebitis, and I've never had that before with my varicose veins. And it started in the upper thigh region, and 1 week it'd be in the left leg, and the next week it'd be in the right leg. So I finally went to my GP, and he says, more than likely you do have phlebitis. It would come and go, and I'll put you on an antibiotic for the cough, and I believe at that time he gave me an inhaler as well in case it's allergies. And he sent me to a vascular surgeon to get my legs checked out. The vascular surgeon, there was no evidence of phlebitis at the time, did the Doppler studies, and he said, well, there's no evidence of DVT, and I recommend stripping your veins in one leg. That visit was in August. We decided to wait to January in between semesters because my teaching load was heavy, and I was on my way. Well, the cough kept getting worse. It was the point where I would have to keep a lozenge in my mouth when I was lecturing. It was annoying to the family even, it was just this constant dry cough. The phlebitis started coming back as well, and I went back to the vascular surgeon. They did more Dopplers. Again, the same thing, no DVT, you have thrombophlebitis. I was prescribed another heavy-duty antibiotic in October 2004, had a chest x-ray. He said, well, Bordetella going around, so we'll try you on this. The chest x-ray was clear, the antibiotic, as soon as I finished it, I lost my appetite, I had indigestion, and I thought it was because of taking this antibiotic. I started feeling full after eating just a little bit. By December 2004, I had 2 more incidences of phlebitis, and they were very bad. And now they were not in the thighs; they were in my knees, the veins close to the knee area. And again, the Doppler showed no DVT. My weight loss persisted, and my cough persisted. By the end of December, when I went to get my pre-surgery evaluation, he said, I'm sorry, I can't do surgery on you. Your legs are in too bad of a shape. You might have a clotting factor deficiency disorder, so I'm going to send you back to your GP. I'll give him a call. Now, we're at Christmas, New Year's break type thing, and I said, yeah, right. But he says he'll give him a call. I let the first of the year go by. He had not called. my GP, so I made an appointment anyway. 2 days prior to that appointment, I felt a mass on my right side. And when I went in for the appointment, he did a pelvic exam at the time and ordered an ultrasound, and it showed a 20-centimeter mass. He sent me immediately to a gynecologic oncologist, and surgery was scheduled for January 13th at that point. For that pre-op, my legs had been feeling really full. They did not get very large like you would for DVTs. I kept calling the doctors. Everybody says, well, you'd be in excruciating pain and your legs would be extremely large. You probably don't have a DVT. But for that pre-op appointment, I walked into the doctor's office and I said, I need to have another Doppler. And sure enough, there were 3 areas in one leg showing clots to DVT. So they immediately hospitalized me, put me on a heparin drip. I wanted that tumor out. The oncologist said, well, we might need to send you home, get your clotting factor value stabilized before doing surgery. But instead, they put in a vena cava filter at that time and proceeded with surgery. So I was very glad about that. And they started chemotherapy, the Taxol and carboplatin 2 weeks later. Go back, my CT scans for this are still clear. I'm starting with new symptoms now. He could not see anything on exam, and so I was to come back in 2 months. I came back within a few weeks, and again, another lesion was found in the same area. So they treated that with surgery, excising a small portion. So that was in 2006. And fortunately, I've been very clear since then. But there's 3 take-home messages that I'd like to share with you. One of which is the phlebitis. That really should have been a sign, since it was seen in both legs, a sign of cancer, and it should have been investigated further than what it had been. Second of all, these scans. They don't always show a lesion when it's present. The lesion was large enough that it should have been picked up, but it's either it didn't pick it up or it was not read properly. And the third thing is the CA-125. At the time of surgery, mine was 145 units per ml, which, as she had mentioned, that's, it's increased, but usually you look for values of greater than 1,000 to indicate malignancy. Mine had decreased after 3 doses of chemotherapy down to below 10, which was a good prognostic value. And it never went back up. Even with the 2 recurrences, the CA-125 stayed below 10.